Hello, everyone, and welcome to SciLine's media briefing on loneliness and longevity, where we're going to look into one of the nation's really most pressing mental health and public health issues, the current epidemic of sorts of loneliness and social isolation in the United States. And we're going to do that today with a particular emphasis on the elderly, the nation's fastest growing demographic age group. I'm SciLine's director, Rick Weiss. Welcome. For those of you not familiar with us, SciLine is a philanthropically funded, editorially independent, free service for reporters based at the nonprofit American Association for the Advancement of Science. Our mission is simply to make it as easy as possible for you as reporters to include scientist sources and scientifically validated information in your news stories, whether those stories are about a topic in science or are simply about goings-ons in your community, where a little dose of scientific research about those topics will help strengthen your story. And of course, in our view, almost any story can be made better by adding some scientific research results that are relevant to the topic you're talking about. A couple of quick logistical details before we get started. We have 3 panelists today who will make short presentations of up to about 7 minutes each before we open things up to Q&A. To ask a question, you can do so during their presentations or afterwards by going down to the Q&A icon at the bottom of your Zoom screen. Simply hover over that Q&A button and insert your name, the name of your publication, and your question, and include information about who you'd like that question posed to if you care. A full video of this briefing is going to be available probably within an hour or so up on our website after this briefing, and a transcript with timestamps will be available a day or two after that. If you need raw video faster than that, just get in touch via that Q&A prompt, and we will get you something as immediately as possible after the end of this briefing today. You can also use the Q&A box to ask SciLine staff if you're having technical issues of any kind. Okay, I'm not going to give full introductions for our 3 speakers today. That would be too time-consuming with all their bona fides, and it is all located on our website on the Media Briefings page. I just want to tell you that we will hear first from Julianne Holt-Lundstad, who is a professor of psychology and neuroscience and director of the Social Connection and Health Lab at Brigham Young University. And she's going to get us up to speed on some basic concepts and some of the research that's drawn links between loneliness and isolation on the one hand and mental and physical health outcomes on the other. Second, we're going to hear from Dr. Ashwin Kotwal, an assistant professor of medicine at UCSF, and he's going to focus on the process of assessing loneliness and isolation in older adults and some of the approaches that clinicians are taking to address this mental and physical health issue. And finally, we're going to hear from Dr. Karen Fingerman, a professor of human development and family sciences and director of the Texas Aging and Longevity Center at UT Austin, who will talk about some of the research that has deepened our understanding about the health benefits of social experiences, how family and friends and sometimes technology can mitigate the effects of loneliness, especially, again, late in life. Okay, so let's just get started with the presentations, and over to you, Dr. Holt-Lundstad.
Thank you so much. I'm just going to quickly take a moment to pull my slides up.
Yep.
Well, thank you so much. I really appreciate this opportunity to speak to you all. I want to start by asking you to imagine a new treatment that could increase your survival by as much as 50%. It also can reduce your risk for cardiovascular disease by 29% and stroke by 32%. It can reduce your likelihood of developing depression and dementia. In fact, it also can increase your immune responses to vaccines and to viruses. And in fact, it also comes with few side effects and actually can increase your well-being. Well, now, of course, everyone would want to invest in that. And what I'm actually referring to is social connection. And although it's not a new treatment, everyone should invest in their social connections. And I hope to share some of the reasons why. So, one of the truisms in life is that people often don't appreciate what truly matters until it's taken away. And so, while it's clear that the global pandemic brought greater awareness to the importance of our social connections for our well being, it's clear that this is not a new issue. There is decades of scientific evidence documenting not only influences on our emotional well being, but significant influences on our survival and longevity. But concerning trends began before the pandemic, and so getting back to normal is not going to be enough. And the urgency of this public health issue has resulted in international and national efforts, including a recent Surgeon General's advisory, which I was the lead scientific editor on. A Surgeon General's advisory is quite noteworthy because it's a public statement that calls the American people's attention to an urgent public health issue and provides recommendations on how it should be addressed. And the most prominent of these, of course, was on smoking that led to significant societal change. But advisories are reserved for significant public health challenges that need the American people's urgent attention. So what is loneliness? I hear it colloquially used very broadly and often used as a catch-all term for all forms of lacking social connection. But there is a more specific definition of loneliness. It is specifically a subjective, distressing feeling resulting from a discrepancy or unmet need between an individual's desired and actual level of connection. And it's important to note that both loneliness specifically and the larger issue of lacking social connection are important. And of course, the public perception is that isolation and loneliness are the result of the pandemic. And yet we have evidence of these concerning trends from the American Time Use Survey that goes back 2 decades. So for example, we see time spent in isolation has significantly increased. Household and non-household family, time spent with them has significantly decreased. Similarly, time spent engaging with friends and others in our community and companionship have also significantly decreased over the past 2 decades. And there's some evidence to suggest that some of these trends go back even farther. So it's not surprising that according to some estimates, roughly 1 in 2 American adults report experiencing loneliness. Further, data from 1.3 million texts obtained from the National Crisis Line reveal the number 1 source of crisis was relationships. And so this really underscores the need to pay attention not to the quality of these relationships, because 1 in 3 was related to relationship stress or dysfunction, while 1 in 5 was related to absence of human contact. So it's important to note that this goes beyond loneliness and that all aspects of social connection have been linked to both health and longevity. And so our attention needs to be paid to all aspects of this. Social connection is clearly underappreciated. It's often seen as nice to have, but not essential. And yet it's critical for individual and population health, well-being, community safety, resilience, and prosperity. But unfortunately, far too many people lack social connection in 1 or more ways, compromising these benefits. This stems from the widely accepted note that humans are fundamentally a social species. This social need is reflected in our neurobiology that can shape our thinking, behavior, and functioning. So for example, evidence points to dysregulation across multiple biological systems when various social needs are not met. And if sustained over time, this dysregulation can lead to the development of disease and compromising our longevity. This has been linked to physical health outcomes, including cardiovascular disease, stroke, type 2 diabetes, mental and behavioral health, including depression and anxiety, suicidality and addiction, as well as cognitive health, including cognitive decline, dementia, and specifically Alzheimer's disease. There's also evidence linking this to economic health outcomes, including billions in healthcare spending, lost productivity, and according to one estimate, 154 billion due to workplace absenteeism and lower quality of work. Some of the strongest evidence is related to longevity. So for example, lacking social connection is on par with other well-known risk factors for mortality. Now, I do want to note that this comparison is across indicators of lacking social connection and is not specific just to loneliness. And while all aspects of social connection have been linked to health and longevity, some may be stronger predictors than others. So for example, one large national study found that social isolation is a stronger predictor of physical health outcomes and mortality, while loneliness is a stronger predictor of mental health outcomes. And finally, going beyond health outcomes, several studies also document the importance of social connection in times of crises, and the ability to mobilize resources via one's social connections can be a matter of life and death. And so communities where people know one another are better prepared for, respond to, and recover more quickly from natural disasters than those with lower levels of social connection. And so as extreme weather patterns become more frequent, connected communities are going to be crucial to weather these kinds of environmental crises as well. So to conclude, this is an issue that affects us all. We all need social connection at all ages, although young may be particularly vulnerable. None of us is immune to lacking social connection. We can all face barriers, but some groups more so than others. And finally, this is simply a human issue. And so I thank you for your attention and turn the time over to the next presenter.
Thanks, Dr. Holt-Lundstad. Great introduction, and I think a really convincing case for starters that this is, as you said, not a nice to have, but a critical to have for proper physical and mental health. We're going to go over now to Ashwin Kotwal.
Great. And yes, thank you, Dr. Holt-Lundstad, for a great introduction to this topic. And I will be building off a lot of those concepts. I'll just share my screen. All right. So I'll be discussing loneliness and social isolation among older adults. I have a few disclosures. So Dr. Holt-Lundstad gave a really nice overview of the definitions of these concepts. I also think about loneliness and social isolation as markers of our social health that have emerged in recent years that really give a good picture of whether people are meeting their social needs adequately. So loneliness being the subjective feeling of lacking connection to other people. People who are lonely may have a desire for more relationships, or at least more satisfying social relationships. And a popular phrase is you can feel lonely in a crowded room, right? So people may be surrounded by friends, family, or even be married and still feel lonely. Social isolation is a related but distinct concept, as indicated by this Venn diagram, of having objectively few social relationships. They may have a few social roles, group memberships, or infrequent social interaction. And I really think of this as a complete or near complete lack of contact with society. One key point I'd like to make is that loneliness and social isolation are not unique to older ages. As Dr. Holt-Lundstad just mentioned, this affects us all. And in recent years, we've noticed that young people may be particularly vulnerable. And I want to counter some of the ageist stereotypes that are prevalent of older adults kind of being locked away in their rooms, not engaging with the rest of society. In fact, many studies indicate that older adults tend to be more engaged with community groups and quite participatory compared to other age groups. And yet there are unique considerations that can disrupt how older adults cope with loneliness and isolation. And there are unique considerations when we consider the health impacts. So first, what goes along with aging that can impact how we cope with loneliness and isolation? There are a number of important losses which predict these experiences at older ages. That can include the death of a spouse, or the death of or other loss of relatives and friends. Some of these relationships are incredibly meaningful and difficult to replace, or people don't want to replace those relationships at all. Changes in living arrangements or institutionalization, where people move from their homes of decades to communities that may be less familiar. And of course, health issues, deteriorating physical health, the impaired mobility, which can make getting to social activities more challenging, impairment in vision or hearing, or even multiple sensory loss, and reduced social activity, or really reduced opportunities to engage socially with community activities that may not be adapted to older adults. And so just to summarize, social isolation and loneliness impact health along many different aspects of well-being for older adults. As mentioned earlier, people who are lonely or isolated can have a higher mortality or shorter lifespan than we would hope. And it greatly impacts quality of life, right? So older adults have a greater likelihood of loss of independence. That includes functional impairment, frailty, and being more relegated to their home or being homebound. They're more likely to require nursing home assistance. This was just demonstrated in a recent study published in 2023 in the Journal of the American Medical Association. And they can have poorer quality of life. Loneliness is associated with higher levels of pain, depression, fatigue, poor sleep, and the cluster of these symptoms. Older adults who are lonely tend to have higher use of medications with adverse side effects, including benzodiazepines, opioids, and antidepressants. And of course, cognitive impairment can be a big downstream impact of loneliness and isolation. As clinicians, we often care about, traditional physical and mental health issues. As a geriatrician and palliative care physician, increasingly notice that loneliness and isolation are in and of themselves important to patients and family members. In a seminal study that was conducted by Dr. Karen Steinhauser out of Duke University, she actually surveyed patients who were seriously ill, family members, and clinicians about factors that were important to them as they were going through serious illness and approaching the end of life. What she found was that individuals and family members care just as much about social needs as they do about traditional medical and health issues that we tend to prioritize as clinicians. So things like having someone who will listen, sharing time with close friends, the presence of family, being able to help others. And yet our work has demonstrated that individuals with serious illness or approaching the end of life have twice the prevalence of loneliness or social isolation, and that that's even higher for people with certain serious illnesses like dementia or advanced lung disease, which can be particularly isolating conditions. And so we really need to be aware of this and start integrating this into our health systems and the way we approach people's quality of life. So what can we do? Whether you're a clinician, whether you're seeing people in your community, or you're addressing the needs of loved ones, we can all, I think, pitch in to address this epidemic. The first step is, if you're noticing something is off with a loved one, or they're experiencing a major life or health transition, start a conversation. Ask them how they've been feeling lately. I've noticed that talking about loneliness or social isolation can sometimes be hard or awkward. There's a lot of stigma associated with these concepts. So common phrases I use are, I've noticed a lot of people have been feeling lonely recently. Is that something you've been experiencing? Or do you need help connecting with others? When people mention that they're lonely, I think that can be a useful starting point for further discussion. providing space to discuss potential causes and helping process emotion can in and of itself be therapeutic. Sometimes people are experiencing major life transitions, like the loss of a spouse, that doesn't have a simple fix. It doesn't have an easy solution, but simply providing space to show that you care can make a difference. I usually ask, as a second step, for an invitation to address these needs, since it can be really personal and not everyone wants you involved. But if people are interested in help, you can ask people what they think might help and invite them to brainstorm. A third step is just being aware of solutions. So sometimes there's no immediate solution, and that's okay. Showing that you care and want to prioritize their social health can make a difference. But it can be helpful to be aware of solutions. As a physician, there are a number of health factors that we can address, things like vision and hearing, functional needs, getting a walker so that they can make it to their activity, addressing pain. Incontinence is an incredibly strong predictor of loneliness, which we have a number of clinical interventions. Some may want to be more active, like re-engaging with a hobby, more visits or calls from family, joining a local club. And there's also a number of community programs that are available locally that it can be helpful to be aware of. Here are just some of the examples that are available in the Bay Area, for example. Lastly, I think we need to consider policy implications here. Loneliness and isolation are common and may contribute enormously to suffering as individuals age and approach the last years of life. Our medical system spends a lot on treatments of disease, even when these treatments are costly and ineffective. So we need to think about how to prioritize it more on spending towards social care, where we might greatly impact quality of life. As a clinician, we're often on the front line of witnessing these needs, but addressing them is time intensive and complex. So we need to also think about how we can adequately compensate clinical teams for addressing these complex needs. We've learned a lot from the pandemic that community programs can make a huge difference when they have adequate funding and reasonable coordination from local, state, and federal levels. So I think overall, this is a great opportunity to pull the right policy and funding levers to make change. So with that, I will turn it over to the next presenter. Thank you.
Thank you, Dr. Coltwall. Super interesting to hear, for one thing, about older people with medical problems caring just as much about these quote-unquote non-medical issues as the medical ones. A great reminder, not just to healthcare providers, but to family members and others. But also, I appreciate your focus on solutions. I'll remind reporters these slides will be available very quickly after our briefing today for your review. And if you have questions in the meanwhile, you can start putting them into the Q&A box at the bottom. And let's go over now to Dr. Karen Fingerman.
Thank you so much. I'm going to take a slightly different perspective on this and talk a little bit about how different kinds of social ties enhance a sense of belonging or prevent loneliness, and how that emphasis on social ties shifts with age, what's going on in old age. If you think a little bit about what the social world does for you, why does it matter? Well, we've already heard a little bit about social support, that they're going to help you in a crisis. They're going to get you to the doctor. They're going to be there. They're also emotionally rewarding. And in that regard, older adults focus more on emotional rewards in their relationships. And that's partly because they're reaching the end of life. And whenever you're reaching the end of something, spending time with people who are emotionally meaningful increases. So if you think about a time when you were going to move, right before you moved, you were not looking to go to big parties. You were looking to spend time with the people you already knew and loved. Relationships or social connection also provide novelty and stimulation. We need new things. We need new activities to keep our brains active, to keep ourselves active. And they also ground you in daily life. They make you feel like your day is familiar. You know the people who are going to be there. If we take a look at where we get these resources, in general, our close ties are the ones who, family and friends, the people we have known and invested in, provide us with support. They're there. They're the ones who are going to be tangible and practical, and you can confide in them, and you care about them. What we're going to call weak ties, the people who don't fit in that category but are still a part of your life, tend to provide the novelty and stimulation. So if you think about during the pandemic, if you happen to be in the lockdown with other people, at the end of the day, you only had so much conversation. I went into the kitchen and got a snack today. Yes, so did I. You really wanted to talk to someone outside that household, someone who'd done something that you hadn't done that day. In terms of the grounding in daily life, that was the same thing during lockdowns, is that we weren't going out and seeing the barista who knew our order, the guy on the treadmill next to us in the morning when we were working out. And those things were important to us. The weak ties mattered. When you look at the research, even before the pandemic, there was a study that was done on a couple of hundred adults who were 40 in the 1990s, and they were tracked for 25 years. And it turned out that the weak ties were associated with how many close ties you have, but it was the weak ties that carried the weight on whether or not you were depressed, whether or not you were lonely over the years. My own research has looked at much sort of smaller increments of time. We did a study where we assessed older adults every 3 hours. We looked at their level of activity using like a fancy Fitbit. We did a variety of different assessments. And what we found as well is that when they were with the weak ties, they were more physically active. There was a greater level of that. And that makes sense because Americans are incredibly sedentary. And to be with a weak tie, you at least have to get out of your chair to answer the door. But more often than that, you have to get up and leave your home. So those things went together in our study. We also found, though, that they were in a more positive mood when they had a mix, the close ties being there as well. So that emotional component, the mix matters. Now, having had said that, one of the things that happens, at least right now in the modern world, is that we have a choice of how we're having this contact. You can have it in person, you can have it by phone, or you can have it digitally, text, social media, email, video chat. Most of the time, when you look at where they're trying to intervene, you try to use phone calls. People are going to call older adults who can't get out, or they're going to train them to use the digital. And an inconvenient truth is that it looks like, at least from what we know, that the in-person is what's really going to carry the weight and really going to matter to people. So there's a study again that looked daily for 21 days at adults over the age of 65. And they found that it was the days that they had in-person contact when they were in a better mood and less lonely. Now, over the course of the whole thing, the people who used digital media in general also were less lonely. But having had said that, digital media often for older adults is used to enhance the close ties they already have. So it's not a substitution, it's an enhancement. And that's partly because they're using it to reach out to their younger relatives or to friends they already have. And in fact, one of the things that they're finding, a study that was done during COVID discovered, perhaps not surprisingly, that most older adults increased their use of technology. I know that the center that I direct, very quickly, we had instructions on how to use Zoom up on our website, very simplified. We were hoping people over the age of 65 would use it. And that did happen based on the research. There was a study of 5,000 older adults who lived in the community, not in nursing homes, and they had at least one person outside their household. And in general, their use of technology did increase, but the people in their 80s showed a decrease in use of technology. And what the researchers are thinking happened is that they were depending on younger people who came over and kept their technology going. And without them, they could no longer use that technology. And that probably resonates with a lot of us who, turn to our grown children and say, can you come in here? The camera's not working and I'm going to be meeting with, 60 reporters in a few minutes. So, and that's in fact documented in the research literature, and I'm not actually that old. What else do we know? Well, I'll tell you at the holiday season where you might be thinking about this. Back in the 1990s, I did a study of holiday cards. And this is back in the days when people wrote little handwritten messages to people. They got writer's cramp. They, risked getting a paper cut on their tongue to lick an envelope. They walked up through the snow and found a blue box and put it in. And so back in those days, but I think it's still relevant, we got them to fill out a survey for each of their cards. We looked at how much this mattered, and what we found is that these cards made a difference in terms of their sense of belonging at the holiday season, which in many ways is the opposite of loneliness. So receiving these from people they've known for a long time who might not be a part of their life, the college roommate who only touches base once a year, enhanced their sense of belonging. And what that tells us is that at the holiday season, very small gestures may make a difference for other people. We don't know that that can make a difference for a stranger. I don't have those data, and the in-person research suggests that random contact may not. But by the same token, these holiday cards suggest that if you do know the guy on the treadmill next to you, wishing them a happy holiday, bringing some cookies to the barista or the checkout person that you know on a regular basis may in fact make a difference. At least that's what this study suggests. I do have a list of references for you that will be in the slides that may be helpful. And I should acknowledge, just like Dr. Coatwall did, the funding sources that have made a difference in terms of my ability to do the research that I do. Thank you so much. I appreciate the opportunity to speak with you and to be a part of this very prestigious panel. Thank you.
Thanks, Dr. Fingerman. Fascinating presentation and addition to our briefing here. And I have to say, making me feel better about the fact that even if I only reach out to some of these folks once a year with holiday cards, it's better than not at all. And it really might mean something. So with that, we're going to get into the Q&A. Again, the Q&A prompt is at the bottom of your Zoom screen. You can start submitting those, but I always start these briefings with one question from SciLine, and I want to quickly go around the horn with each of you to ask you to address this question, which is basically, as not so much as professionals now, but as news consumers yourself, as you've looked at news coverage of what's going on in this country in the domain of loneliness and social isolation. Tell us, each of you, something that either you think is being done well and right by reporters and that you want to encourage, or if you prefer, something that has sort of been, you've got to be in your bonnet about, something that reporters routinely perhaps get wrong, and maybe this is a chance to set them on the right path. And I'll start with you, Julianne.
Thank you so much. I appreciate it. So one of the things that I really appreciate about what the media has done is to help raise awareness of how important this issue is. And, even just looking at the kinds of articles that are out there, loneliness has become something that is now well recognized as being important for our well-being. The one thing that perhaps could be improved upon is that it's still primarily seen as just an issue of loneliness when there are many aspects of social connection that are important, that have equal effects on our health and well-being. As well as the public perception still seems to view this as primarily associated with emotional well-being. And some of the strongest evidence is around longevity and physical health outcomes. So really where we could perhaps do better in raising some of that awareness is recognizing that both isolation and loneliness and poor quality relationships and lacking social support, all of these things are important, not just loneliness. And recognizing how important it is to our physical health as well.
Great, thank you. Ashwin.
Yes, I'll echo Julianne's appreciation for prior coverage, particularly of the relationship of social connection to health outcomes. I start almost every talk I give to clinicians with the attention that you all have brought to this topic on health outcomes and why clinicians should care. So I think it's made an enormous difference in raising awareness in health systems and making this a priority for clinicians across different disciplines. One area that I think could improve is, I touched on this a little bit during my presentation, is just this concept a lot of the ageism that is quite prevalent in our country. And I think recently I found that media has really helped to counter some of those ageist notions, and I think we can build on that further. Older adults are hugely important contributors to society. We